Downtime at home for a father and son. Cash is 14 years old and requires round-the-clock care.
Little chest rub.
Calgary's Rotary Flames House provides respite care to children like Cash.
The house will be closed. They will be redeployed to the hospital indefinitely.
The hospice is closing temporarily so staff can be redeployed to Alberta Children's Hospital to deal with an unprecedented surge in respiratory illnesses.
It took me a little bit for it to sink in that this was actually happening.
Alberta Health Services says the move will create 6 beds at the hospital.
Our priority is these, responding to the needs of these acutely ill children.
It's the worst flu season in Alberta in more than a decade, and nationwide, children under 5 are the largest group being hospitalised with the flu, forcing children's hospitals across the country to make tough choices. In St John's, the Children's Hospital cancelled some routine surgeries and appointments. In Ontario, Kingston General Hospital is taking in young, very sick patients from across the province to relieve the pressure on other facilities. And in Ottawa, an extraordinary move. The Children's Hospital of Eastern Ontario is asking for support from the Red Cross to assist staff dealing with a surge in young patients. That team starts next week.
What would have been inconceivable prior to the pandemic now seems almost normal, which is probably the scariest sign of all. Like, if you had asked somebody in 2019, do you ever think we're going to have to call in the Red Cross to help support a hospital in a major Canadian city?
Support for a healthcare system that needs help.
This is the situation we are in society, that we're pulling nurses away from the weakest people right now.
And Georgie, you're in Vancouver tonight, where BC Children's Hospital briefly activated a code orange this weekend.
Yeah, a code orange was activated at BC Children's Hospital for 30 minutes yesterday morning. It's an emergency code that's used to quickly increase capacity and hospital resources. Now, it's typically reserved for mass casualty events or disasters, but in this case, it was just used to increase staffing levels. A hospital spokesperson told CBC News that demand for hospital resources remains high. The emergency department wait times today, for instance, exceeded 9 hours, and that their staff will continue to try to meet that increased demand from patients right now. Ian?
All right. Thank you, Georgie.